mentioned earlier that there are many side effects with these drugs. I would say that many of these side effects are manageable, but it does require some back and forth with your doctor and your oncology team so that these side effects are optimally addressed. Many of these side effects overlap between these two drugs, but the couple that I will highlight is that with Mobocertinib, I would say most, if not all, patients will get some sort of some level of diarrhea. The severity of diarrhea will vary by patient, but if you are going on to Mobocertinib, I would expect to have diarrhea. Now, the severity of diarrhea does get better with lower dose, so that's why my patients, or many of my patients on this drug, I ask them to come in fairly frequently in the beginning until we can find the right dose that's tolerable for them. And you can read the other side effects on that list. For Amivantamab, the two side effects that are most common are rash. Again, the severity of rash can vary by patient. And the rash usually stays as long as treatment is continued. Now, the second very common side effect is an infusion reaction, and what this is an allergic reaction to the drugs, and a lot of people will have this, but this is usually an early side effect where once we can get patients over the hump of the initial treatments, it tends not to happen with later treatment. So a lot of side effects, but again, I would say that many of these are bothersome, but many of my patients will say that they're manageable. So when is the best time to receive these drugs? The first thing I would say is that we don't really know that these drugs are better than chemotherapy. And each doctor will have a bit of a different style in terms of what to give first, but I personally like to give chemo first because it's more tried and true. But either drug would be reasonable to try at some point as they work differently. Now, one question I get asked a lot is, should we try Mobocertinib first or Amivantamab first or vice versa? And I tend to choose one drug over the other really based on patient's preference. So for example, I have many patients who come from afar and it's just not feasible for them to come every week or even every other week. So I may start with the pill and try to manage their side effects remotely from the side effects from Mobocertinib remotely. But if a patient is close to the cancer center and don't mind coming in often, and some patients even prefer to come in often, then the infusion Amivantamab treatment would be reasonable as well. And the last point here is that immunotherapy is usually not very effective in this type of lung cancer, so it's not one of the initial treatments that I would give to my patients.